The emergency room doors burst open as paramedics rushed in with a stretcher. On it lay the mayor of Westfield, his face pale and contorted in pain. Dr. Marcus Taylor stood near the nurse's station, reviewing a chart when he heard the commotion. "Someone get a doctor now!" yelled one of the paramedics. Dr. Taylor approached quickly. "I'm Dr. Taylor. What's the situation?" A woman in an expensive suit, the mayor's assistant, looked at Dr. Taylor in his blue scrubs and dark skin, then glanced past him toward the hallway. "We need the attending physician," she said firmly. "Mayor Peterson needs immediate attention. Where's Dr. Williams?" Dr. Taylor maintained his professional composure. "I am the attending physician on duty. Now please, tell me what happened while I examine the patient." This wasn't the first time Marcus had been mistaken for something other than what he was, one of the hospital's top diagnostic specialists with 15 years of experience. But right now, that didn't matter. What mattered was the man struggling to breathe on the stretcher before him. Westfield Memorial Hospital. Westfield Memorial Hospital stood tall in the center of the city, its glass and steel structure gleaming in the morning sunlight. Inside its walls, life and death played out daily, with dedicated medical professionals working tirelessly to tip the scales in favor of life. Dr. Marcus Taylor had joined the hospital staff 5 years ago after completing his fellowship at Johns Hopkins. At 42, he had earned a reputation as one of the best diagnosticians in the state. His colleagues respected his sharp mind and calm demeanor, especially in crisis situations. But respect didn't always translate to recognition, at least not from patients or their families. Too often, people would look right past him, assuming he was a nurse, an orderly, or anyone but the doctor in charge. Marcus had learned to push past these moments, focusing instead on what mattered most, providing excellent care to everyone who needed it. Today was shaping up to be especially challenging. The emergency room was already busy when Mayor Richard Peterson was brought in, clutching his chest and having difficulty breathing. The mayor's presence immediately created a stir, with his security detail and staff demanding the best care possible. "Dr. Williams isn't available right now," the charge nurse Linda Chen explained to the mayor's assistant. "Dr. Taylor is our attending physician and one of our finest doctors." The assistant, Vanessa Reed, looked skeptically at Marcus. "Are you sure the mayor needs a specialist?" "Dr. Taylor is a specialist," Linda replied firmly. "Now please, let him do his job." Marcus nodded gratefully to Linda. This kind of interaction wasn't new to either of them. "Mayor Peterson," Marcus said, leaning over the patient. "I'm Dr. Taylor. Can you tell me what you're experiencing?" The mayor, a man in his 60s with silver hair and usually commanding presence, looked vulnerable and frightened. "Chest pain," he gasped. "Can't breathe right. Started during my speech." "On a scale of 1 to 10, how would you rate the pain?" Marcus asked, placing his stethoscope on the mayor's chest. 8. "Maybe 9, the mayor managed. Marcus listened carefully to the mayor's heart and lungs while checking the monitors the nurses had attached. The mayor's heart rate was elevated, his blood pressure high, and his oxygen levels lower than they should be. "Get a chest X-ray and ECG immediately," Marcus ordered. "I also want a complete blood panel, including cardiac enzymes." As the nurses moved efficiently to carry out his instructions, Marcus turned to Vanessa. "Has the mayor had any heart problems?" "In the past, he had a mild heart attack 2 years ago," she replied, her tone slightly less dismissive now. "He's been on medication since then." "What medication specifically?" Marcus asked. Vanessa looked through her phone. "Lisinopril and a baby aspirin. Daily. Also something for cholesterol." "Has he complained of any symptoms recently? Shortness of breath, fatigue, discomfort?" "He's been tired, but we thought it was just the campaign schedule," Vanessa admitted. "He mentioned some indigestion last night." Marcus nodded, making mental notes. The most obvious diagnosis would be another heart attack, but something about the mayor's presentation wasn't quite matching up. His instincts, honed over years of practice, were telling him to look deeper. A different diagnosis, The initial test results came back quickly. The ECG showed some irregularities, but not the classic signs of a heart attack. The chest X-ray revealed something unexpected. A slightly enlarged heart shadow and what appeared to be fluid in the lungs. This isn't a simple heart attack, Marcus murmured to himself. He ordered additional tests, including a more comprehensive cardiac workup and a D-dimer test to check for blood clots. While waiting for those results, he continued monitoring the mayor, whose condition wasn't improving despite receiving oxygen and preliminary treatment. Dr. Patricia Williams, the hospital's chief of cardiology, arrived an hour later. Vanessa Reed's face visibly relaxed when she saw Dr. Williams, a tall, older white woman with short gray hair. "Dr. Williams, thank goodness you're here," Vanessa said. "Mayor Peterson needs your expertise." Dr. Williams glanced at the chart. Marcus had been updating. "I see Dr. Taylor is already on the case. What's your thinking, Marcus?" The presentation initially suggested cardiac distress, but the test results aren't typical for a myocardial infarction, Marcus explained professionally. The enlarged heart shadow on the X-ray combined with the fluid in the lungs and his symptoms has me considering pericardial effusion or possibly a pulmonary embolism. Dr. Williams nodded thoughtfully. "Interesting. What additional tests have you ordered?" D-dimer, comprehensive metabolic panel, and I'd like to get an echocardiogram to visualize what's happening. "Good call," Dr. Williams agreed. "Let's get that echo done, Stat." Vanessa looked between the two doctors, clearly confused by their exchange. "So Dr. Taylor is one of our finest diagnosticians," Dr. Williams completed her sentence. "I'd trust him with my own life. Now, if you'll excuse us, we need to continue evaluating the mayor." The echocardiogram revealed what Marcus had suspected. There was fluid collecting around the mayor's heart, constraining its ability to pump effectively. This condition, called cardiac tamponade, was life-threatening and required immediate intervention. "He needs a pericardiocentesis," Marcus stated, referring to the procedure to drain the fluid from around the heart. "Agreed," Dr. Williams said. "Would you like to perform it? Or shall I?" "I can handle it," Marcus replied confidently. Vanessa stepped forward. "Wait, what exactly is happening? I thought he was having a heart attack." "Mayor Peterson has fluid collecting around his heart," Marcus explained patiently. "This is compressing the heart and preventing it from pumping properly. That's why he's experiencing chest pain and difficulty breathing. It's not a heart attack, but it is life-threatening. We need to drain this fluid immediately to relieve the pressure." "What caused this?" Vanessa asked, her earlier skepticism replaced with concern. "There are several possibilities," Marcus said. "It could be related to his previous heart condition, an infection, or even an autoimmune response. We'll run tests on the fluid to determine the cause." "But you can fix it," she pressed. "The procedure has a high success rate when performed promptly," Marcus assured her. "And we're going to do it right now." The life-saving procedure. Marcus prepared for the pericardiocentesis, a delicate procedure that involved inserting a needle through the chest wall and into the pericardial space around the heart to drain the accumulated fluid. The procedure room was tense as nurses assisted him in setting up. "Have you done this before?" Mayor Peterson asked weakly as Marcus prepared the area on his chest. "Many times," Marcus assured him. "You're in good hands, Mayor." Mayor Peterson nodded, too exhausted and frightened to question further. The local anesthetic was administered, and Marcus worked with careful precision, guided by ultrasound imaging. The needle found its mark, and slowly, amber-colored fluid began to drain from around the mayor's heart. Almost immediately, the monitors showed improvement in the mayor's vital signs as the pressure on his heart decreased. Marcus collected samples of the fluid for laboratory analysis, which would help determine what had caused the condition in the first place. "Excellent work," Dr. Williams commented, observing from nearby. When the procedure was complete, the mayor was breathing more easily, his color improving by the minute. He looked up at Marcus with genuine gratitude. "Thank you, doctor," he said, his voice stronger than before. "I guess I owe you my life." "Just doing my job, Mayor Peterson," Marcus replied with a small smile. "We'll need to keep you here for observation and to determine what caused this condition, but the immediate danger has passed." Vanessa stood awkwardly nearby, watching the exchange. "Dr. Taylor, I owe you an apology." Marcus met her gaze steadily. "No apology necessary. What matters is that Mayor Peterson received the care he needed." But they both knew what had happened earlier. The assumptions made, the expertise questioned based solely on appearance. It was a familiar pattern to Marcus, though no less disappointing each time it occurred. The recovery room Mayor Peterson was transferred to the cardiac care unit for close monitoring.